Onto a much more serious topic, and that is the idea of the problem that we have with stigma and ignorance about substance use disorders. People that hold stigma and ignorance are not just people who are uneducated about the disease of addiction or substance use disorders. It is widespread. It is people involved in policy making about substance use disorders. It's physicians, it's nurses, it's hospital administrators. Many people around the country have a very poor understanding of what substance use disorders are. And as a result of that, they have created this environment of stigma and ignorance around these diseases. 90% of people in this country who need treatment for a substance use disorder don't get it. And they don't get it because they don't think they need it. Why don't they think they need it? Because society has trained them that they don't need treatment. Society has told them over and over again that you're a weak-willed bad person who's just stupid and ignorant, and you just need to quit. Of course, we know that that's not possible for patients with substance use disorders because it's just not possible. That's not the way the brain is wired in these folks. And so the idea of treating these patients poorly because they have a substance use disorder in any aspect of society is a big part of the problem with why we are losing the battle of addiction treatment nowadays. The number of overdose deaths is climbing. Okay, 100,000 people in the last 12 months died in this country. That's somewhere in the realm of 2,000 a week. And that's unacceptable. And so what are we doing wrong? Well, we don't treat the disease of addiction or substance use disorders like we treat other chronic illnesses. If patients come into the emergency room, for example, with searing chest pain, they get immediately evaluated, rushed up to the cath lab, they get stents placed or they get sent for emergency cardiac surgery. There's a protocol in place for how they should be treated, and hospitals are graded on how effective they are at treating those patients. If someone comes in searing pain because they're in withdrawal from opioids, they get pushed to the back of the emergency department and ignored for several hours after they've received some kind of reversal, which makes their pain even worse. And then they leave against medical advice because they're in so much horrible pain that they got to get out of the hospital and go use again. Now, fortunately, here at Licking Memorial, we have a much more appropriate attitude on how these patients should be treated. And that's one of the wonderful things about working here, and about one of the wonderful things about getting treatment here, is that we don't have that bias here at Licking Memorial Hospital. And you can get your substance use disorder treated without being under the shadow of stigma and ignorance. There's still pockets of it, there's no question about it, and there are individual practitioners around and staff members and so forth who have a negative attitude about people with these disorders. But fortunately, here at Licking Memorial, we have a treatment program that's affiliated with it, closely affiliated with it. In fact, we're a department of the hospital. So they get a bit more education than the average hospital about what these disorders involve. And when I see how these patients are treated around the country and how they're denied appropriate health care simply because they have a disease that somebody doesn't like, it makes me sick, literally sick. And many of these deaths that occurred unnecessarily. A lot of patients who, and I get an opportunity to review overdose deaths with the coroner on a quarterly basis. Many of these patients went to an emergency room or a doctor sometime in the previous week seeking help. And instead of getting help, they didn't get the help they needed, and they ended up either killing themselves, committing suicide, or dying from overdose. All of which are unfortunate outcomes for somebody who doesn't deserve that at all. And so one of the things that my job involves, and one of the things we do here at Shepherd Hill, is try to spread the word and educate not just our patients, but the public about what it means to have a substance use disorder, why it's not a shameful thing. Yes, addicts and alcoholics commit shameful acts, okay? They do. People with cardiac disease eat too many bacon cheeseburgers, okay? And they make their disease worse, and they continue to smoke. But we don't throw them out of the hospital, or we don't deny them appropriate health care when they come in with chest pain. And nationwide, we need to have the attitude that these folks deserve the care that any other patient, sick patient with a chronic illness deserves. And when we reach that stage, I think we have a good chance of significantly reducing the problem of overdose death and the problems caused by substance use disorders in our society. And that's all I got to say about that for now.